I'm Dr. Raman Gurai with the Spine and Nerve Diagnostic Center, and I want to talk to you today about regenerative medicine. Introduce the topic. What is it? How does it apply? And are you a good candidate for it? I'll start by contrasting it to something you're already familiar with. Anti-inflammatory steroid injections. They've been around for over a century. There's plenty of good data behind it. Helps a lot of people. But steroids are not without their risks. And it's typically 9 out of 10 times when you go to a doctor's office or you hear of a friend or colleague going to the doctor's office and receiving an injection, it's usually steroid based. But more recently, we've come out with some new and exciting technology known as regenerative medicine, orthobiologics, that takes the healing process to a whole different level. Let me tell you what it is. Regenerative medicine refers to primarily prolotherapy, PRP, and stem cell injections. Prolotherapy is a direct dextrose-based solution. PRP stands for platelet-rich plasma, that's derived from your own body's blood. And bone marrow, again, derived from your body as well. You can get that from fat cells, you can get that from bone marrow that's within your bones. And there's other sources, but those are the two primarily that are used nowadays. So what is the idea behind regenerative medicine? The idea is this. Steroids work by an anti-inflammatory process. Regenerative medicine takes that idea and flips it on its ear. So the idea is this. To understand, it's a pro-inflammatory process, and you think to yourself, why would I want a pro-inflammatory? We always associate inflammation with bad food, bad healing, but the truth of the matter is your body actually uses the healing, the inflammatory process to heal. And so the way that works is you have an injury, blood vessels dilate, they blow up, bring in blood, and with the blood comes nutrients and healing cells, healing factors. So that's actually how the body heals. Unfortunately, sometimes that healing process doesn't go to completion or it's not quite right, and that's where you might need a little bit of help. So some very smart people thought to themselves, okay, well, what if we take the own body's healing mechanism and harness that? So that's exactly what we did. So platelet-rich plasma, PRP, takes your own blood. We spin it down in a centrifuge machine and we isolate platelets, which are part of your one of the components of your blood. There's red blood cells, white blood cells, but platelets are another component that typically are used for blood clotting. Now, those platelets also contain chemicals that can help heal and attract other cells that heal. So the idea is you spin down that blood product we obtained from you and concentrate that platelet, inject it back into a tissue that's injured or not completely healed, with the idea now to restart that process, kind of give it a jump start. And that's the idea behind platelet-rich plasma. Prolotherapy is a dextrose-based solution that promotes the same idea. Introduce an irritant to an area that's not quite healed and promote the healing process. Stem cells, now that takes the regenerative medicine idea to a whole different level. Stem cells are really exciting because of this. You have to know that there's something called precursor cells, and these cells are not quite differentiated. We have heart cells, we have muscle cells, we have bone cells, but precursor cells can become any one of those things if you put it in the right environment. Now we found some of these precursor cells in your body. Sometimes they're found in fat, sometimes in bone marrow, which is inside the bones. And so we can access those cells, and when we introduce them back into muscle or cartilage, the idea is they grow into new tissue. So obviously that's very exciting. We're still harnessing that ability, but that's where the future is now and where it's headed. So are you a good candidate for this therapy? If you have received steroid injections without benefit, or you're leery about steroid injections in general, come talk to your doctor about it. This application applies for all sorts of soft tissue injuries, including plantar fasciitis, lateral epicondylitis. So those are all examples of overuse injuries of tendons, or what we call fascia, which are connective tissue in the body, really big sources of pain. And it's beautifully applicable to those areas of pain. I myself have applied this to my mother-in-law for her tennis elbow, lateral epicondylitis. I've done it for my patients for spine issues, chronic pain, acute pain. And so you can apply these to soft tissue as muscles, tendons, ligaments are. You can inject this into joints, and that includes shoulders, hips, knees, joints, and the spine. So the limits really are endless on this. Wherever you can think of having pain in your body, there's a chance that this therapy may help you. So if this is something that you may be interested in, come in, talk to one of your providers, and see if you're a good candidate.